So, good morning, students. This is Dr. K. Kishore. I am Associate Professor in Department of Biochemistry at Ambrose College. So, today topic for discussion is eicosanoids. So, we will go into the details. So, these eicosanoids are 20 carbon polyunsaturated fatty acid related compounds, and particularly they are derived from arachidonic acid. So there are different groups of these eicosanoids. So we have to get ourselves familiarized with the names: prostanoic acid, leukotrienes, lipoxins. And again, prostanoids, you have prostaglandins, prostacyclins, thromboxanes. So we will be going into details, learning about the synthesis of these particular compounds. This is a broad overview of what are these eicosanoids, and among these eicosanoids again you have a classification: prostanoids, leukotrienes, and lipoxins. Prostanoids are again divided into prostaglandins, prostacyclins, and thromboxanes. So a bit of details about prostaglandins. These prostaglandins were first isolated from prostate tissue, and they are the most potent biologically active substances. They are involved in they're supposed to cause smooth muscle contraction, and they are also known as local hormones. So coming to the chemical structure of these prostaglandins, they are derived from 20 carbon cyclic fatty acid, particularly prostanoic acid. And you will have a lot of substitutions to these prostaglandins. They are having different nomenclature. So naturally, they are you have alpha-oriented OH group at carbon 15. Then if you look at this particular diagram, you can see there is like part A, you have a prostanoic acid structure. You can see at one first carbon you will have this carboxylic group, and this is a 20 carbon fatty acid. Okay, and in the diagram part B gives you the detail about prostaglandin F2. So these prostaglandins will be differing in the substrate group. Suppose in the part B of this diagram, you can see that at fifth and sixth carbon there is a double bond, and there is a OH group at 9th position, and at 11th position you have another hydroxyl group, and 13 to 14 you have another double bond, and 15th carbon you have a hydroxyl group. So it's like this. There will be like prostaglandin will be having different types of prostaglandins will be there based on the substance groups. Okay, then coming to the C part of this diagram, you can see that there is a oxane ring in this structure. You can see, and this compound is thromboxane A2. So the salient features of prostaglandins, like I was telling, now there will be a nomenclature. Like PGA has a substance group like keto group at C9 and a double bond between C10 and C11. Like that, we have looked into this PGF, which has a hydroxyl group at C9 and C11. Okay, and in the same way, prostaglandin I will be having a double ring oxygen attached to C6 and C9 to form another 5-membered ring, hence it is called as prostacyclin. Then coming to the biosynthesis of prostaglandins, generally these prostaglandins are derived from membrane-bound phospholipid, particularly by the action of phospholipase. You will have that arachidonic acid coming out, and then this particular phospholipase is stimulated by epinephrine and thrombin, and it is cortisol inhibits that particular enzyme. So from arachidonic acid, you will have the starting of synthesis of prostaglandins. There is a very important enzyme called as cyclooxygenase, and you can see in this diagram like aspirin and indomethacin are the drugs which can inhibit the formation of prostaglandins. Like this is a biologically applicable point regarding prostaglandins. So from arachidonic acid, you will have formation of prostaglandin G2, and in further reactions, you will have formation of PGH2, which by prostacyclin synthase will be forming PGI2, and you have another bypass like another route wherein thromboxane synthase converts PGH2 to thromboxane A2. And then by the action of 15-hydroxy dehydrogenase, there will be inactivation of these prostaglandins. And PGH2 can be converted by isomerase to PGD2, and then it is again converted to PGE2 reductase, PGF2. So almost all of these prostaglandins, they will be acting en route a very important enzyme for synthesizing cyclic AMP. This is one of the secondary messenger. So these prostaglandins act as local hormones, and they will act through this particular secondary messenger, cyclic AMP, to cause their biological effects. Okay. So key enzyme in this pathway is cyclooxygenase. And next, to make different types of prostaglandins, you have prostacyclin synthase and thromboxane synthase. And coming to this mechanism of action, they are being known as local hormones, and they act by G protein coupled receptors, and PG increases cyclic AMP levels, and there are some details like adipose tissue and renal tubular cells. PGE lowers cyclic AMP level. In general, they will be acting through that secondary messenger, cyclic AMP. So PGI activates adenyl cyclase, and thromboxanes, they will inhibit that adenyl cyclase. Then coming to this mechanism of action of aspirin, this is a very important short note for the university examination. You can see that this very important enzyme cyclooxygenase is irreversibly acetylated by aspirin, and you can see that therefore aspirin is useful in prevention of heart attacks. Okay, they have some role in preventing heart attacks, particularly because they will be acting on this cyclooxygenase enzyme, and which happens to be very important at the level of platelet metabolism. So by inhibiting cyclooxygenase, aspirin will reduce PGI2, and so aspirin completely blocks this thromboxane A2 formation. Okay, so in this way, these like aspirin, indomethacin, ibuprofen, they will intervene with the prostaglandin synthesis. So this paracetamol is also a very important reversible inhibitor for this enzyme. This is like pharmacological applications of prostaglandin. Then the physiological effects of these prostaglandins are basically inflammation. They are involved in inflammation, particularly PGE2, PGE1. They will induce inflammation and that wheel flare reactions like redness, vasodilation, swelling, edema. Then pain and fever. Pyrogens, they will stimulate the formation of these PGE2. Then PGE2 also enhances the duration of pain, bradykinin, histamine, allergic substance. So prostaglandins are also like indicated in reproduction, like PGE2, PGF2 have been used to induce parturition as well as for the termination of pregnancy, and they have a role even in male infertility. So then prostaglandin functions, they can affect cardiovascular system, they have effect on uterus, female reproductive system, respiratory system, and then they will also affect, they will cause inflammation, and they also have effects on GIT. Then coming to the effect of prostaglandins on CVS, there is this PGI2, they generally lead to vasodilation, and they will also inhibit platelet aggregation, and these prostaglandins, they will lower blood pressure. Then effects on uterus, PGF2 is given to induce labor, and it is also given for termination of pregnancy, and also arresting postpartum hemorrhage. Then coming to the respiratory system, effect on respiratory system, they will cause bronchoconstriction, whereas PGE causes bronchodilation. Then effects on inflammation, PGE2 is involved in inflammatory response. Then coming to effect on GET, many of these PGE2 related compounds will suppress the gastric secretion, and they are used as treatment for peptic disease, acid peptic disease. Then coming to the functions, metabolic effects, like they will generally modulate the CAMP, that is cyclic messenger, secondary messenger production, cyclic AMP production, and then PGE2 decreases lipolysis. It is also involved in increasing calcium ablation and also uh, glycogen synthesis. So regarding the prostacyclins, there is like differentiation between functions of prostacyclins and thromboxanes, and there are some characters which we are considering here. Like regarding the structure, cyclopentane ring will be there in PGI2, thromboxane ring will be there in oxane. Like you will have oxane ring, site of formation endothelium platelet, cyclic AMP, PGI2 increases, whereas thromboxane decreases. Platelet aggregation is inhibited by PGI2, whereas thromboxane it enhances the platelet aggregation. Blood vessel vasodilation is the function, like exact opposite function happens with thromboxanes. So in the examination, there will be a question on differentiating, like what are the differences between actions and site of formation structure regarding prostacyclins and thromboxanes. So on the bronchioles, they will relax, PGI2 relaxes uh, bronchioles, whereas thromboxane E2 causes constriction. Then these are first formed from thromboxanes, are first formed from platelet thrombocytes, and you have a nomenclature based on the number of double bonds. And main functions of these thromboxanes are they will increase platelet aggregation, they will cause vasoconstriction, mobilization of intracellular calcium, smooth muscle contraction, and bronchoconstriction. Leukotrienes, as the name suggests, they are being first described in leukocytes. You have five classes, and then you have subscripts, and subscripts will be giving you the number of double bonds. Then coming to the synthesis of leukotrienes, it happens in leukocytes, platelets, and they are in response to both immunological and non-immunological stimuli. You will have synthesis of leukotrienes from arachidonic acid. One important point to consider here is that they will be forming by lipoxygenase pathway, whereas those prostaglandins were coming from cyclooxygenase pathway. Here, leukotriene synthesis happens by lipoxygenase pathway. So this is just a flow chart giving you the detail of synthesis of leukotrienes. You can see lipoxygenase, and then HPT will be forming. Then you will have glutathione will be coming into the reaction, and you will have sequentially formation of A, B, C type and D type of leukotrienes. Then functions of leukotrienes, you can see they increase chemotaxis, facilitate inflammation allergic reactions, contractions and smooth muscle, bronchoconstriction and vasoconstriction. Then lipoxins, like there are a group of compounds produced from leukocytes. LXA4 is a common variety, and it is involved in anti-inflammatory, and it decreases the immune response. Then, okay, so this is the detail that we have to learn regarding prostacyclin. So we have looked into the details about prostaglandin synthesis and what are the different types of prostaglandins. Okay, and then we have looked into details about thromboxanes and their effects on CVS reproduction, and also in inflammatory responses, immunological reactions. So they are being generally known as local hormones. So we have looked into particularly that vasoconstriction and vasodilation functions of these local hormones, as well as bronchoconstriction and bronchodilation. Okay, not to miss the main statement for this class. The prostacyclins and prostathromboxanes, generally they will be having exact opposite effects on both the respiratory system as well as uh, vessel blood vessel interface. At blood vessel interface, they will be having vasodilation and vasoconstriction. So we have learned about those details from this session. Okay. So lipoxygenase pathway gives you leukotrienes, whereas cyclooxygenase pathway gives you like different types of prostaglandins. So with this, I think if you have any queries, you can look into the details and learn. And if you can have any queries, you can come back. Thank you.